Our first question is for any new fitter who is not feeling fully competent with Ortho-K, would you suggest decreasing fees for those first few cases? So, Nick, what do you think? Would you consider decreasing fees for the first few cases?
I would not. And fee development is almost the number one question that gets asked whenever I discuss specialty care. The reason, whether you're a seasoned fitter or a new fitter, you have to determine the fees that make sense for your practice. I think the practitioner has to appreciate patients aren't paying us necessarily only for our level of skill. They're reimbursing us for the care we provide, often to their child. So if this new practitioner, develops fees that are low because they don't have confidence in their fittings, in their skills, they may not deliver the care that a patient expects, and you won't get secondary referrals from friends and families. So this is how I develop fees. I spend about an hour with a patient to determine if they're a candidate for Ortho-K. So I always talk about chair costs. So this new or seasoned practitioner has to determine how much does it cost my practice to be open every hour. That's a chair cost. So for example, if your accountant says that you need to earn $2,000 a day and you're open 10 hours a day, let's say, your chair cost is $200 an hour. So this practitioner has to decide if they're going to embrace Ortho-K. They have to invest the time, not only in fitting them, but to assure the parent or the patient that they're going to be well taken care of. And that takes time. That's really a commodity these days in the health profession. So I would encourage this practitioner to do their due diligence, to do the best they can in learning a design that they feel comfortable with. And when they get a potential candidate, and hopefully we'll talk about this, that their fees reflect the time they spend with the patient. If they're not sure, just ask their staff. Because when I started 20 years ago, I was just like them. I really didn't know what to charge. But my staff knew exactly what to charge because they knew the value of my time. So I hope that makes sense to you, Matt.
Oh, it definitely does. And I think back to pre-pandemic, whenever I would, be at a bar or party or whatever, and I would talk about what I do and end up describing Ortho-K and myopia control. And one of the top questions I get from just talking about it casually is, why have I never heard of this? And one of the answers to that question is, well, not every doctor can do it. And if you are a doctor who's going to do this, then you need to get paid for your time because you're spending that much more time and investment and energy in that patient experience. You're giving them the kind of attention that they're probably not getting from your standard optometrist. Would you agree with that?
Absolutely. The energy is the aspect. So for example, most of my patients today are referred by friends and family. And we're going to talk about how I've done that, hopefully over this podcast series. But I got a phone call the other day of a parent who heard about Ortho-K, didn't know much about it, but was concerned about their child's myopia. This is a typical case. If my staff says the consultation is 1 hour, the consultation costs this much, the program costs this much, the parent is most likely going to ask, is insurance covered by this? How come other doctors? And they hang up. They say, thank you. So what I do in my office is I get on the phone. I'm not afraid of it. And I call the parent back. I said, listen, my name is Dr. D. I'm in charge of this clinic within our office. Can you tell me a little bit about my child? And this way, I develop that rapport that you're talking about. So there's a lot of energy in me making the parent feel I am the best doctor for their child. After that, money has no relevance. As a parent, I know this. As an optometrist who's been practicing 30 years, I know when I charge $1,000 for Ortho-K and $6,000 for Ortho-K, it doesn't matter. What matters is, does the parent have confidence in me and my office in taking the best care of their child? So I got on the phone. I speak to the parent for about, I would say 10 to 15 minutes. They say, this is great. I want to come in. I said, that's great. My staff is going to make an appointment for you. That's when fees were discussed by my staff. And you know what she said? This is a true story, Matt. You know what? I'm getting a little buyer's remorse. I really didn't feel like I'm ready for this. This sounds like I have to pay for the consultation. Sounds can I think about it? And my staff said, you know what? No problem. We'll send you some information. So the academy has information. This doctor also, another question he or she asked is, do I send them research articles? No. I just send them information that relates to what the parent spoke to me about. For this example, I sent them information on why playing outside is important. I sent them some information on dual focus soft contact lenses. I sent them some information on atropine eye drops. It's not the information. It's that I've taken the time to follow up. And sure enough, this parent called back and made an appointment for a consultation. They're actually coming tonight. So it's a process. So this optometrist should realize that, yes, this is scary because insurance doesn't cover this, and that you're going to have to place the energy to convince a parent that you're the right office for their child, and that takes time. But this is the key, Matt. Once this parent comes in, they're actually coming in tonight to see my partner, we're going to spend an hour. There's no eye doctor, there's no physician that I know of, other than maybe a specialist, that spends an hour with anyone these days. And we have been doing this a long time. I don't need an hour to determine what lens fit. I need about, to be honest with you, 5 minutes. But the rest of the exam is to make that parent and child feel, I'm the best office for you. And that's where this OD has to make a switch in that, should I reduce my fees? No, they're not paying me for my skill. They're paying me for the care I provide. They're paying for me and what am I worth?
Definitely. And I can identify with that just from a patient perspective, because when it comes to my general doctor, she is extremely thorough lets me ask lots of questions. She spends a lot of time with me. It's my annual checkup. What do you want to talk about? I mean, we respect each other. We're not going to waste each other's time.
Sure.
And I really appreciate the fact that she cares and that she will sit there and talk with me and spend the time on me. And so I don't mind coming to see her. I recommend her often. So it's just, we live in that kind of era where it's like, people want to feel like people. They want to feel like you care about them. And who better to do that than their healthcare providers?
Right. Can I ask you a question? Do you pay out of pocket, or is that something that's covered by your health insurance?
So interestingly enough, when I first started seeing her, it was not in network, and she is in network now.
Okay.
So I gained the benefit of being able to see her. But beforehand, I was like, that's not a factor. I'm willing to pay out of pocket to see her. And they have like a flex spending system in place for non-insurance patients. And they also give, They also give a discounted rate too, if you're not an insurance patient.
Right. Time of service discount.
Mm-hmm. Right. So, they're definitely a cut above the rest. When I found her, I was like, hey, this reminds me of Carrie in the way I worked in his practice. It reminds me of how he practices. And it reminds me of all these amazing men and women in the AAOMC who I've come to know over the years who follow that same kind of discipline.
Right. And for this OD that's asking the question, and everybody out there, every membership is like, yeah, that's easy to say, but now I'm not in network. I have to really prove myself. And this OD, in this case, he or she can't say I'm experienced. She's actually, or he's actually inexperienced. But this is the key to remember. You can never win price by price. It's a falling knife, because what he or she will find out with time, you'll never be the lowest. And if you just say, listen, I am going to charge you less because I'm new, or I'm one of the lowest out there, well, that's really not a key selling point. I think if this doctor that you have the appointment with, Matt, and you're paying out of pocket, and they say, listen, my fee is a lot less than the doctor across the street, and I spend more time, I don't think that's a selling point. The selling point is, how does she make you feel when you're sitting across from her, correct?
Right, exactly.
So I think that's what every physician, what I've learned, and I'm much older, and it's easier for me to say because I've played the game of fee reduction. You can't win that game. Is you just have to know what you're worth, your chair cost, the amount of care you provide, and just be very confident. Trust me on this, and I'm a practitioner, and this is only my opinion, but I've been doing this a long time and I enjoy it, is that you deserve a certain level of reimbursement for your chairside manner. And it's different for all of us. So feel confident in knowing eventually a patient will say, yes, I want to enroll in your program because I'm really trusting you, doctor. There's no greater praise that a patient could pay us is by saying, I'm willing to pay out of pocket to be treated or my child to be treated by you.